And thank you also, Ranking Member Torres, as well, and the rest of the members of the subcommittee for allowing me to be here today to talk about Indian Health Services. Many of the items that you discussed in your opening statements are very true. I couldn't find anything in there that I would disagree with. I do want to point out that we have increased funding for Indian Health Services over many, many years, and since I've been in Congress, we've done that, but we still have not seen improvements. In fact, the situation's only gotten worse, and that's one of the reasons you have this bill before you today. I appreciate the opportunity to talk about H.R. 2662. It's the Restoring Accountability in the Indian Health Service Act. And before I begin, I wanted to also inform you that yesterday I was told the HHS senior staff are traveling to South Dakota this week. They're going to visit the IHS hospital at the Pine Ridge Indian Reservation, which is the home to the Oglala Sioux tribe. That's one of the areas that has been the worst in the nation. The Great Plains District has been a disaster. We've had third world care being delivered there. And just a few weeks ago, I had asked Secretary Price for his leadership and his help in addressing the situations that we're currently facing. And so I want to thank him and his team for his quick action in going there this week to look at the situation on the ground. I look forward to working with them to find solutions to the many issues that we face in Indian country. Now, turning to our hearing today, I personally thank the witnesses who traveled here to Washington, D.C. to be at this hearing, especially Mr. William Bearshield from the Rosebud Sioux tribe. Mr. Bearshield has testified before you before. In fact, he was here to testify on the legislation that I had last Congress, and he's here to offer his critical insights into what the situation is on the ground. Last year, I too sat before the subcommittee testifying on the same issue. I told you that the state of Indian health in South Dakota had fallen to emergency levels. And today I can report to you that in some areas we've seen a little bit of progress, but it's not enough. We need to get help to these people that are relying on this agency for health care, and they're failing them dramatically. Since this most recent crisis has begun, the Center for Medicaid and Medicare Services has found 3 IHS hospitals in South Dakota to be deficient, which resulted in the closure of 2 emergency rooms. Now, one has since reopened, but nonetheless, these closures have put a serious strain on local community hospitals. It's drastically curtailed the access to care for my constituents. Many of them are traveling much farther in situations. In fact, I believe Mr. Bearshield will talk today about they believe they've lost lives because of the situation of IHS not delivering care that's needed. And it's not just South Dakota that's been affected, it's a nationwide issue. The hospital serving the Winnebago and Omaha tribes had its relationship with CMS almost completely severed. And most recently, a hospital in Minnesota was cited by CMS as well. In fact, my constituents tell me that the only reason that some IHS facilities are open today is because CMS just hasn't visited them yet. I'm working hard to produce legislative solutions to this problem. Last year, I introduced the Helping Ensure Accountability, Leadership, and Trust in Tribal Health Care Act, and the subcommittee held a hearing. Today, the bill looks a little bit different, and I'll tell you why. It's because I've worked together with my colleagues in the Senate to craft a bill that includes elements of that bill that I had last Congress, but also a bill that Senator Barrasso introduced last year. His bill was called the IHS Accountability Act. The result of our cooperation is identical bills in the House and the Senate, and I'm pleased that we're working together to address the serious deficiencies in the agency. The Restoring Accountability in the IHS Act contains several meaningful provisions and ensures that the agency's employees are held accountable. For example, the bill requires regular reporting from IHS as well as GAO and the HHS Inspector General. Now, reporting is going to be critical. In our discussions with IHS over the last several years, the agency has been able to even provide us with basic data related to its regular operations, which seemed pretty basic to us, but we realized they had not done any kind of data collection or reporting. The reporting will ensure that Congress has the information it needs to conduct oversight and make good decisions in the future. The bill also improves recruitment and retention by allowing the agency to look at employees and how they get them to come and serve at these facilities. The bill also will help IHS attract new management talent by allowing those managers to participate in the student loan repayment program. This is just an overview, but the bill contains several other provisions to improve patient care and streamline IHS processes. This bill, while important, though I want to be clear, is just a first step. There's so much to do in Indian country to address the substance abuse, the domestic abuse, the violent crime, the child abuse, and most tragically, the youth suicide situation that we're seeing on our tribes in South Dakota. Tribes in South Dakota are affected by all of those issues, and I look forward to working with you on them in the future. And again, these are situations that if they can't get basic health care, you can see why none of the other needs are being met. I want to get this right. I've always already reached out to HHS and IHS for technical assistance on this bill, so that has been done, and I've worked with stakeholders across Indian country, patients, tribal leaders, IHS employees, healthcare providers, private hospitals to submit testimony for the record and give us feedback on the bill. So I'm excited to work with you and our tribes, and thank you for the opportunity to discuss this bill with you today.